next question is, what would be a good stretch to relieve tension while I am working at a desk all day?
Okay, so desk work is rough because you're in a chair that you probably don't love, because you're at a desk that you probably don't want to be at. And I think, again, just getting up and moving around is the best thing for you. So, like, make your, to go check your phone, make it so that you have to get up and walk across the room to do it. But as far as stretches go, anything that's going to get you out of this flex posture. So doing a rowing exercise where we're strengthening our rhomboids, or going into a door frame and stretching our pecs out. So this is pec minor, pec major. There's 3 different parts to that. So doing anything that can get us out of that flex forward into more of an extension posture is going to be huge for any type of desk work that you have to do.
That makes sense.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. I am so excited to talk today all about chiropractic care and how it can help with things like carpal tunnel syndrome and other ailments.
There's so many common ailments that chiropractic care can help with, and people are always like, oh, but should I go to the chiropractor? The good thing is we're going to have 2 doctors of chiropractic with us today, Dr. Jane Brewer and Dr. Elizabeth Hoefer. They'll be able to tell us all about carpal tunnel syndrome and all those other common ailments.
Yes, you're going to learn so much.
We sure are.
Let's bring them in. Hello, Dr. Jane and Dr. Hoefer. We are so excited to talk to you both today.
We sure are.
Yes, everything about carpal tunnel and other ailments. Oh, I'm glad I don't have carpal tunnel.
Me either. I know, but there are so many people out there who are suffering with a number of ailments and, of course, with carpal tunnel, and we want to have you address those. But before we do, we really want to know why you're passionate about chiropractic care. What is it about chiropractic care that made you want to jump right in?
Well, it saved my life.
Yeah.
So I wanted to be able to give back to the way that it helped me. And so being able to be a chiropractor has been a very fulfilling career.
How did it save your life?
When I got adjusted in 2007, I suffered from depression and anxiety and all kinds of mental health stuff that was just overwhelming. I got an upper cervical correction and it healed me. And so I wanted to spend the rest of my life being able to give that same hope to people.
That's incredible.
It is.
What about for you, Dr. Jane? Why'd you decide you wanted to be a chiropractor?
Once I learned about chiropractic, I couldn't unknow it. And it changed my life as well in different ways. And I think the biggest thing it's done for me is given me a framework to understand that our bodies are incredibly intelligent. We are designed to be self-healing, self-regulating, self-maintaining. And that is the beautiful philosophy with chiropractic, that it acknowledges the intelligence of the body and it gives people the tools that they need to be able to embrace that more natural way of healing.
That's so great. What causes things like carpal tunnel, if we want to just jump right in?
Okay.
Can you go into that a little bit?
So carpal tunnel syndrome, it affects the median nerve. And that median nerve, and we'll kind of go upstream a little bit to start out with, all the nerves that feed into the arm and hand all start from the neck. And they form kind of a network, or what's called a plexus, kind of underneath the collarbone here, and then they go on to communicate basically with all of the arm and hand. And the nerves in our body control everything. Every little movement we make, everything we sense and feel, how we relate to the world outside of us, and how everything on the inside is regulated. And so in the case of carpal tunnel, there is compression, and the carpals are the wrist bones, and that median nerve goes through a tunnel, and for reasons that can be caused by an injury or just repetitive use, wear and tear, that tunnel narrows and it creates irritation to that nerve. And that can cause numbness, tingling, pain, all of those symptoms that we attribute to carpal tunnel.
Can you tell us about the carpal tunnel syndrome test? I've heard about that, especially in pregnancy.
Yeah. And so there's 2 tests that I'm familiar with for carpal tunnel. One is called Phelan's test. That's where you might hold your hands in this position for 30 to 60 seconds to see if it reproduces those symptoms. That might be indicative of some trouble there in the wrist. And then there's also a test called Tinel's. And I think, we all know those little triangular reflex hammers that our doctors would
Oh, yeah.
whack us in the
Oh,
knee.
yeah.
You can actually tap in that area, and if it causes that zinger up that nerve, it could also potentially be a sign that that
Oh, yeah.
is what's going on.
How common is carpal tunnel syndrome, Dr. Hoefer?
I think a lot of people suffer from what they would label as carpal tunnel syndrome, but I'm not necessarily sure that it's actually the problem. And what Dr. Jane was alluding to is that, believe it or not, there's 11 different points from our wrist to our neck where that median nerve can be entrapped. So what we like to do is look at the very first point. And if we can get that decompressed, if you will, if we can get that addressed, a lot of times the downstream issues go away.
Okay.
So instead of treating a symptom, we're going to look for the root cause, which oftentimes comes from an issue in the neck that then becomes the plexus, that becomes the median nerve. So we like to look at the root cause.
Are there certain symptoms that people should be looking out for to be indicators of carpal tunnel syndrome?
I think, like Jane said, it's the numbness, the tingling, the inability for you to have range of motion in your wrist, and all of a sudden you have loss of dexterity in your fingers. That kind of thing is a common symptom for carpal tunnel syndrome.
Why is it so common in pregnancy, by the way?
Well, our blood volume grows because as we grow a human, that changes our physiology. Our tissues swell. And so when there's more compression in an area of a small diameter, it affects the function of the nerve.
Okay.
How has the treatment for carpal tunnel been changing as you've seen it over the course of the last few decades? Because I've heard of like non-surgical methods now.
I think chiropractic here is a perfect example of a non-surgical method.
Okay.
Yeah.
And like we were just discussing, if we can really get to the source of where that might be starting, that's going to be the most beneficial solution for people. Instead of just chasing around symptoms, just look upstream. And that's something that we offer. And of course, there's chiropractors who would also adjust the elbow or adjust the wrist to reposition the joints there to create more space so that that nerve can actually communicate the way it's supposed to.
I see. Are there exercises you can do also with chiropractic care?
I think, if it's coming from the wrist, putting your hands in that prayer position, and sometimes a splint will be recommended to sleep in. I don't know if
My
you've
friend
I've
had to
seen
do
that, yeah.
And so that splint actually takes the wrist and it brings it back, because as we go to sleep, it's the cozy thing to kind of have everything kind of come inward. That actually puts compression on that carpal tunnel. So those splints that we wear at night would help the wrist stay in that more neutral to that upward positioned way, so that that nerve has more space to
That makes sense.
hang out.
Is it also common at postpartum with breastfeeding? I felt pain right here.
course.
Okay. I don't know if that's carpal tunnel, but
Well, I think that, again, it's repetitive motion.
Repetitive,
and when
yeah.
you are nursing your baby, you're in a position for many minutes or hours at a time, making sure that your child is nourished. And so as the mother, like making sure that you're getting your baby fed, you lose track of yourself. And you're more focused on the well-being of that child. And all of a sudden you realize, like, oh my gosh, I didn't want this baby to cry for 6 hours, so I held it just like this because that's how they sleep well. And all of a sudden your arm is numb.
Yeah.
And so we sacrifice ourselves to take care of our babies.
Yeah.
And I mean, I don't think that's carpal tunnel in and of itself, but
okay.
it's that repetitive motion, and it's that sacrifice of our own, our own well-being to protect the life of our child.
Yes. Of
course.
But it's amazing how quickly we put ourselves into these compromised positions structurally and neurologically, and we wonder why we have all these back pains and all these neck pains and all these wrist pains and shoulder pains. So you had talked about exercise. There's a really cool thing that you can do. It's called nerve flossing.
Oh.
And it's essentially helping to stretch out your arm and your nerves, kind of like flossing your teeth, but you're flossing your nerves and you're moving them and stretching them.
And so that nerve lives in a sheath.
Yes. And it helps to take away the irritation.
Yes.
And it gives some comfort and some relief.
Is ice therapy something that you also incorporate, and if so, how?
Absolutely. I love recommending ice. It's one of the most effective and financially attractive ways to help reduce inflammation and pain. And I always recommend 10 minutes on, off for an hour, because it takes 10 minutes to be a therapeutic effect. And you don't want to actually burn your skin or your
Right.
tissue. And you can do that with ice. But then it takes about an hour for your skin to get back to room temperature. So oftentimes, whenever I'm delivering care to my patient, I always say, I want you to ice and I want you to do it for 10 minutes on and then off for an hour. Just long enough for the skin to get back to its normal temperature so that you can do it again.
Okay. Wow. What are some of the types of adjustments that you do for carpal tunnel?
Well, as Jane said, some chiropractors look at wrists, some of them look at the elbow, you can look at the shoulder, pretty much anything in the chain of biomechanical use. But what we do in the upper cervical world is we actually study the neck. And we look specifically at the top of the neck to make sure that the brain and the body are communicating at the place where they come together. So the atlas, the axis, the cervical spine. We look there very specifically with guided imagery where we take three-dimensional x-rays and we put those bones very specifically into alignment so that all of the nerves don't have any irritation and then you have better function.
Oh, wow.
I want to make sure we point this out to people who are listening right now. Both of you are diplomates, this is correct,
Yes.
in chiropractic craniocervical junction procedures, or DCCJP for short, right? And that's an elite group of chiropractors who have a specialty. But the number is really tiny. I want you to talk to that a little bit, just so our audience is able to understand, like, you have the special training that's extra special.
Right.
So that's a really cool thing. Both Dr. Hoefer and I are recognized by the International Chiropractors Association Council on Upper Cervical Care as diplomates. And really what that means is that we, of course, completed our general chiropractic degree, which is the DC degree. And then for about 3 years, we really focused in to study just this one tiny area. And to this date, and there's another cohort going through this program now, but there's about 60 of us who practice across the world.
60,
In the whole
Yeah, in the whole world.
Right.
That's amazing.
And so it's a really cool thing to do what we do and to offer the expertise that we have.
Yeah.
It's just a really special thing.
It really is special.
Yes, and it's a
Which is-
delicate area. It's a very complex area.
For sure.
Structurally, neurologically. This is by far the most freely movable part of the spine, where the head sits on top of the neck.
Yeah.
It is designed for mobility, so it's inherently more unstable. And it just requires a careful, dedicated approach, and we have the training to be
Yeah.
able to do that.
So great. Are there also other therapies for carpal tunnel, like myofascial release, soft tissue? Would you do that with carpal tunnel?
I mean, yeah, I think there are a lot of different practitioners that address the soft tissue. There's, massage therapists. There's people who do rolfing. I would say physical therapy probably has an entire protocol of different exercises that they employ. But the neat thing about chiropractic is that our work sets the stage for all of those other things to be even more effective.
I see.
So
Okay.
structural integrity leads to better function.
That makes
And
sense,
better
yeah.
function can happen through all those different things, massage therapy, PT, things like that.
Yeah, and I would say things like acupuncture, dry needling, even some supplements. There's some evidence to support the use of vitamin B6 in carpal tunnel. And so there's other avenues to, again, support the structural work that we do.
Now, I will say my best friend that I referenced that had carpal tunnel in pregnancy ended up having surgery on both wrists. I know.
Wow.
Why did she have that? Why didn't she do chiropractic
Well,
care?
we're not surgeons, so we can't speak to why
Right,
they would
yeah.
make that decision. But obviously, she saw a practitioner that thought that that was the best form of care,
Okay.
and that was the information that appeared real to her at the time to make that decision.
So sometimes is surgery necessary, or when is it necessary?
Of course. And, I always tell my patients there's a time and a place for everything.
Okay.
And from my perspective, I think it's the most beneficial thing to do to exhaust all of the conservative
Yes.
options first before going under the knife, because there's no guarantee that a surgery is going to be successful and that it's going to provide the outcomes that you need. And unless you're, of course, in a tremendous amount of pain and suffering, and surgery is the obvious best thing to do, then I'm a big fan of trying a lot more conservative options first.
Yeah, that makes sense.
Yeah.
How can chiropractic care help with some of these common ailments like sciatica, vertigo, migraines, TMJ, Dr. Hoefer?
Oh my goodness. That list is just a small fraction of the things that chiropractic care can help with. But ultimately, what it boils down to is making sure that the structure is in alignment so that the body and the brain can communicate effectively. Speaking to vertigo, the brain simply can't decide where it is in space. And so you start to spin. And so you have that sensation of not feeling like you're balanced. And that's a really common thing that upper cervical chiropractors have the opportunity to help with. And it's often something that most medical doctors refer us for, because it's really neat to be able to have that communication and that relationship with other kind of practitioners, and they realize like their medication and their procedures that they have just aren't doing the trick, and so they refer to specialists like us in the upper cervical realm of chiropractic so that we can address that specific issue.
That makes sense. What about other things like TMJ? How does it help with that?
Yeah. That's a cool space that I've been getting into a bit, working with dentists who focus on TMJ and, teeth grinding, clenching, but also airway issues. Because if you think about it, we all think that the top teeth are not super movable, but the truth is our top teeth are moving every single time we move our neck. And so the resting position of the jaw is totally inseparable from the resting position of the atlas that holds the head up. And that's a really cool space for collaboration between us and dental professionals, is providing that consistent and reproducible place for those top teeth to live in, so that we can fit the mandible or the bottom teeth to that.
Oh, wow.
Dr. Jane, how would you say that chiropractic provides a more holistic approach to overall wellness for your patients?
The first thing that comes to mind is that we really treat each person as an individual. And really, we're all different. We have got all the same basic pieces and parts, but we're all put together a little bit differently. And I think that's the really cool thing about what we do, is that we just take care of that one person in front of us, one at a time. And it's really individualized. So I think it's a really special thing. And also acknowledging that our bodies are incredibly smart. And sometimes just something gets in the way of us feeling as healthy and expressing life as well as we are optimally able to. And I think that's one of the most cool things that we do, is we work with that inborn innate power that we all have within us and seek to maximize what's going right. I think so much of healthcare really zeroes in on what's wrong, what's gone wrong. But I think at any given time, we have so much more going right in our bodies than we do going wrong. And if we can maximize what's going right, the things that are not up to snuff are gonna get better.
Yeah, that makes sense.
And when it comes to pain management, how does chiropractic help with that and relieving pain?
I mean, from a neurological standpoint, we truly affect the nociceptors, and that's like the pain receptors that we have in our
Okay,
body.
I'm like, wait, I don't know what that is.
Exactly. So
Nociceptor,
nociceptor. And so when you have a pain response, it's signaling some part of your body to your brain, and it's setting off a signal. And pain is information. And so chiropractic helps to reduce that signal so that you don't express or experience the pain in the same way that you might without the treatment. So it's very effective.
It's amazing. What is the importance of choosing a licensed, experienced chiropractor, and what should people look for when choosing one?
And I think it also just depends on what somebody's looking for, what their goals are. And if somebody wants to just have some quick temporary relief, there's options for them. If people are looking for a longer lasting solution, there's options tailored for that too. And adjustments can be used in different ways. So people can use an adjustment like they use an aspirin and only take one when you need it. But there are other people, and I would advocate that this is, I think, one of the best ways to utilize chiropractic here, is to really just more incorporate it into your lifestyle. And it's so much easier to stay healthy than it is to start chasing your tail once things start going wrong.
There is that.
Yeah.
And there's so many misconceptions out there about chiropractic and people being fearful of what they don't know.
Of course.
How do you help dispel some of those myths and empower
Yeah.
people to make decisions about their own
Yes.
health?
It's a really good question. I think just meeting people where they are, understanding truly what their misconception is, what their fear is, and then just listening to them, and then having the answer to help them really take the fear away, because it's really basic science. It's just truly structural alignment. And when we start to just understand where they're coming from and give them an analogy that makes sense to them, the fear disappears. And then they're like, why didn't I try this sooner?
Yeah.
There's so many people that I meet that we're their last hope, and they've been encouraged not to see a chiropractor, but they've tried everything else. So they come under duress with all of this fear and trepidation. They get a correction and they are like, why didn't I do this 15 years ago? And that is so rewarding to turn
Yeah.
skeptics into, believers.
And those people often become, I think, our biggest champions.
Absolutely.
And they
For sure.
refer
I believe
their
that.
families,
Yes.
refer their friends, because it's just a surprise. And I like to surprise my patients, and I will often bring those misconceptions up before they even have a chance to ask.
Yes.
And I think that's a refreshing thing for people to receive in the healthcare landscape is just that
100%.
dose of honesty.
Yeah.
And be like, I know that there's these misconceptions out there. I know people think they have to, come in twice a week for the rest of their life, but if you put it all out there from the beginning, I think it just takes the guard down immediately.
so
And
right.
it's just a person to person.
Yeah, I have to admit, I told my chiropractor I
Yeah.
don't adjust my neck because I was so scared of it, you know?
Of course.
But little by little, I got more comfortable
Yeah.
to the point where I'm fine now.
Yeah.
And I think that that's what happens when you have a relationship with a chiropractor. We're naturally people,
Yeah.
And so we want to talk and have relationship. And the truth is, anything that we do in life, it's always about relationship and establishing trust. So when we have a relationship and we have trust, we're going to get a better result because naturally we just are able to relax and trust the
Yeah.
process.
Exactly.
Dr. Jane, what are some resources that you offer your patients so that they're able to pay for care?
So one of the biggest options that we offer our patients is the CareCredit credit card. And sometimes patients come into our office already having that. And that's awesome because they can then use it in our clinic. But then, of course, they have the option to apply for that. And that just allows people to finance their care. It just makes care accessible to them where it may not have been otherwise.
The other thing that's really cool is that people want to finance care for their entire family. So we'll get a mom coming in and then she'll realize that not only does she need care, but so does her husband and all of her kids. So being able to finance care for the family and have it be a family affair is really important. It's a great
Yeah.
option.
Okay, it's time for Ask the Expert. This is when our audience gets to ask you questions. You're our experts, obviously. Yeah, that's y'all. And here's the first question. Are arthritis and carpal tunnel syndrome related?
So in the traditional sense, what we think of as arthritis, which really just means inflammation in a joint, we typically think about arthritis as just that wear and tear and breaking down of the joints. It can be. If those joints in the wrist wear down, it can cause compression on the nerve. I think where a specific type of arthritis and carpal tunnel are related is what's called rheumatoid arthritis. That is very different. That is an autoimmune mediated condition. And I think folks that have rheumatoid arthritis are more susceptible to developing carpal tunnel syndrome. But that is different from osteoarthritis, which means just the degenerative changes that happen in the bone.
Okay. All right, this next question is, are there any recommendations for my work from home setup to help with posture and frequent computer use? What about in office? Great question.
Just having an ergonomically set up space. So you're not going to be leaning over your computer hunched. You're not going to be sitting for 8 hours a day. You're also not going to be standing for 8 hours a day. So having a dynamic workspace. I love with this post-COVID world that we live in, people have learned how to work at home and they've got desks that move up and down. They have the opportunity to walk away from their desk and come back. So I love to teach my patients about a little method called the Pomodoro technique, where you work for 25 minutes and then you take a break for 5. Because not only does it give your physiology a break, it gives your mind a break. And we need to
Yes.
have those little brain breaks to be able to stay focused, to be able to keep our nervous system healthy. So, making sure you stay in an upright position that's supported, but not like that all day long. So having dynamic is important.
Do you like those, just a little add-on question from me, do you like those donut pillows for chairs to help with the spine?
It depends. It really depends on the body and the person.
Okay.
So some people sit on a ball and some people sit on a stool and some people stand. But just so that you're changing it up throughout the day, that's really the most important
Oh,
thing.
interesting.
Standing desks became such a big deal during
Do you
COVID.
have one?
I have 2. But you know what I also got? And
that.
first it was for vanity reasons, honestly. But no, not the standing desk. It was this what I put my laptop on. It was because I wanted the camera angle to be a certain way. But the way that has
Yes,
helped with my posture
absolutely.
and alleviated pain in my
Yes.
wrist. I don't have
need
carpal
that
tunnel
link.
syndrome. I'll send the link. But yeah, I mean those can be really beneficial
Yeah,
for
that's
setting
one
up
of
an
the
ergonomic space.
Biggest
sense.
recommendations I make for my patients who work on a laptop specifically,
Yeah.
you can't separate the screen and the keyboard.
No.
Right.
So I just tell folks, get a $20 Bluetooth keyboard. It doesn't have to be expensive, but bring that monitor up to eye level. That would make it a really awkward typing position, but get that Bluetooth
Get the
keyboard so that
keyboard.
you're caring for your neck because you're not looking down.
Exactly.
And then you're caring for your shoulders, elbows, arms, wrists
Love that.
by
I've
bringing
got
that
to do
keyboard
that,
closer
'cause
to you.
I
It
see the
makes
hump coming.
I'm
Such a
sending you
huge
a link.
difference.
Can cracking cracking your knuckles cause carpal tunnel or arthritis? Bust that myth.
I don't think so.
Oh, y'all said the
Old
same
wives'
time.
tale.
That's just an old wives' tale?
Wow.
Yeah.
Really?
Yeah.
I did not know.
I mean,
I
it's
thought it
not
was
great.
related.
Like, I wouldn't ever recommend a patient go around and, forcefully crack their own neck. That is not a good
No,
thing.
not at all.
But the occasional knuckle cracking isn't gonna.
This next question is, what would be a good stretch to relieve tension while I am working at a desk all day?
Okay, so desk work is rough because you're in a chair that you probably don't love, because you're at a desk that you probably don't want to be at. And I think, again, just getting up and moving around is the best thing for you. So, like, make your, to go check your phone, make it so that you have to get up and walk across the room to do it. But as far as stretches go, anything that's going to get you out of this flexed posture. So doing a rowing exercise where we're strengthening our rhomboids, or going into a door frame and stretching our pecs out. So this is pec minor,
that's so good.
pec major. There's 3 different parts to that. So doing anything that can get us out of that flex forward into more of an extension posture is going to be huge for any type of desk work that you have to do.
That makes sense.
I've never heard of this before, but this person wants to know, can you get carpal tunnel syndrome in your feet?
There is actually a condition called tarsal tunnel.
Oh. Because carpal's in the hand.
Yes,
and
so the carpal
wrist.
bones
Yeah.
are in the wrist.
Right.
The tarsals are in your feet.
Okay.
And so in a really similar way, that nerve that goes into the foot also goes through a tunnel. And so it wouldn't be called carpal tunnel. It would be called tarsal tunnel. But yeah.
Is there anything that we didn't ask you about carpal tunnel syndrome or any common ailments that you'd like to add or share with our audience and with us here?
I think the first thing that came to mind, sometimes I hear, well, I just have my normal headache.
Yeah.
That's not
do say
normal.
that.
Headaches
That's
are
not-
not normal.
Okay.
Really? Okay.
And I think we learn to tolerate certain things in our life because we just accept that that's what happens, right? And I would just really encourage people to take a look at that and also understand that there is help out there, and there's help that doesn't require anything invasive, anything painful, and that it works with your body and
awesome.
supports it and encourages it to heal. And so, these symptoms that oftentimes we just brush off as, oh, this is just normal. It's not normal. It's normal to feel great. And of course things happen,
Sure.
but by and large, I think if you're not feeling your best, and ultimately what that means is you're not enjoying a quality of life that is up to your standard, ask for help.
Yeah. And based on what she just said, asking for help, I think that truly the quality of our life is dictated by the quality of the questions that we ask. So if you aren't 100% convinced that what you've got going on is not treatable or addressable, ask a better question. Find a different person. Look into doing more research about whatever it is you're dealing with, because there's people like us who have gone to school and studied even more in a specific area, and that exists across all professions. So just ask better questions, because you're going to have a better quality of life in doing so, and I think you're going to just have a lot less suffering.
That's so
And we all want that, don't
Yeah.
we?
Yes.
Oh, Dr. Jane, Dr. Hoefer, we are so glad that y'all stopped by Care Experts.
Thank you.
Educated us, right?
Yes.
And busted some myths, and then teaching us things like, what is it? Tunnel?
Tarsal.
Tarsal. My bad. Tarsal tunnel syndrome
And
is
that
a
you
thing.
can floss your nerves too.
Oh yeah, I love that. Well,
That's
thank
awesome.
you.
You're so welcome.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.